Hey, this is Dr. Buzz with Buckeye Physical Medicine and Rehab, BuckeyePMR.com's website. Check it out. I'm here today with Mike. What's up, Mike?
What's up, Buzz?
We are going to talk about stem cells, PRP, other regenerative medicine procedures, and kind of focus on not only regular people, but athletes. So we're going to cut the break, and we'll be right back. Hey, this is Dr. Buzz with Buckeye Physical Medicine and Rehab. BuckeyePMR.com is the website. Check it out. Here with Mike, and we're talking about stem cells today, man. Well, stem cells, regenerative medicine, PRP.
We're talking about basically the three most important parts of new medicine today.
Or regenerative medicine.
Regenerative, we should say. And this isn't necessarily new, but it's now to the point where the general public can get this. You don't have to be a Kardashian to be able to afford this.
Yeah. The first I can remember, the first stem cell procedures were done back in 1970 at University of Minnesota. So this isn't something new to planet Earth. It's been around, but you are correct. Like the technology has come to the point now where you don't have to be an athlete. And I can remember the first time I ever heard of stem cells was Kobe Bryant.
Yes.
So Kobe Bryant years ago was going to Europe and was getting stem cells in his knee, and I remember that. But as a general person, like, oh, that's really cool, but like...
Well, it sounded like you had to be, like it was an exclusive club. It just, the money that you needed was to go to Europe. It wasn't that the procedure was expensive. It's who can afford to stay there for 10 to 14 days to get multiple treatments. But that was around the 2008, 2009 time period. The first time I heard about it in the United States was Bartolo Colon in 2011. Mm-hmm. And people remember he pitched for the Indians, the Yankees. At that time, his career was basically over. He needed a way to get past, the physical limitations and the beating his body was taking. But, if you look at that guy, he doesn't look like an athlete. He looks like every guy that's, sitting on his couch. He just happens to be throwing 200 innings a year. But he was the first one I ever heard of it. And I thought, I wonder whatever, did he continue on that path? And he did. And this was after, the whole Balco situation in sports, where it was taking the illegal substances, and those guys were all breaking down. The difference was he was doing this for therapeutic use,
right,
to continue his career and to deal with the pain issues he was having.
Yeah, and it is important to realize, so stem cells, PRP, regenerative medicine, that's okay to use. Athletes are okay to use these things. They're not allowed to use anabolic steroids. But regenerative medicine procedures, and it's not just PRP and stem cells. It's ozone injections. It's class 4 laser therapy, shockwave therapy. All the things we do at Buckeye. These are fine for high school athletes to do, college athletes to do. There's no restrictions on these, if that makes sense. And really, what regenerative medicine is, it's a new branch of medicine, and it did start out in Europe. And I think the reason it took off in Europe before in the United States is our healthcare system is so jacked up here with insurance companies and. Regenerative medicine is considered elective, just like anti-aging's considered elective. And back in the 80s, everyone had really good insurance. I can remember, you have a $100 deductible, if anything, $5 copay. So if a patient would come in and someone would offer, hey, we can do this regenerative medicine procedure, it might cost you some money, or go with what your insurance covers, people would say, well, man, my insurance, I want whatever my insurance covers.
Right.
But what's happened over time is pretty much everyone's insurance stinks now.
Right.
Thanks to the Affordable Health Care Act, which made it unaffordable. But
that whole exchange system, really what it did was it restricted what you could do and what procedures you could get. The good news is with Buckeye Anti-Aging, what you've done is you've made this affordable and accessible to people. The biggest issue is we always have to educate people that it's out there and what it does.
Right. Because people don't even think it's real. It doesn't sound real. When people come to my office and there's it happens every day. We had 4 ladies that came in yesterday. They were told they have to have knee replacement surgery. We evaluate them. They're going to do amazing with these stem cell allografts in their knees. They're not going to need surgery. I mean, and really, you're really saving lives. 1 in 400 people that has a knee replacement surgery dies. 1 in 400. You might say, well, that's pretty good odds. Well, I'm flying out of Columbus. I'm going down to the stem cell lab today. Can you imagine if there's a sign up in the airport that said 1 in every 400 plane crashes and everyone dies?
Yeah, you wouldn't be flying.
I wouldn't be flying. I'd walk before I'd fly.
Right.
But that's what people don't understand. Like, there's always risk with surgery. We have a sister clinic in Miami, Dr. Joe down there, and he does all the same things we do here at Buckeye, regenerative medicine procedures. But Dr. Joe tore his pec. So if you completely rupture a pec, you have to have surgery. Stem cells won't fix it, won't reattach it. And Joe's a very healthy guy like me. They actually work with the University of Miami with the football team down there, so he had access to the best surgeon. So it was right before Christmas. He's like, I'm going to get the surgery done. It's a great surgeon. He's the guy that does the Dolphins and the Hurricanes. I trust him, whatever. And he wouldn't have the surgery done. Flew home. He did right before Christmas. Went to spend the week or the holidays with his family back up there. And he called me Christmas Day. He's, man, how's it going? Checking on him. He's like, I got the flu. I just feel terrible. I was like, all right, well, I hope you feel better. He called me the next morning. He said, man, I'm sweating my brains out. I think something's wrong.
Oh, did he get an infection or something?
Got an infection from the surgery. So this is a healthy individual that went to the best surgeon, one of the best surgeons, if not the best in Florida, and did everything properly, and ended up coming back. They flew him, they basically called in to the doctor. The doctor's like, you need to be back here tomorrow morning first thing. So he flew back, the day after Christmas, 7:00 in the morning. They opened him back up to clean all the infection out. He ended up spending 2 weeks in the hospital, multiple surgeries. Luckily he came through. But I mean, this is a healthy individual. What if he was an older person or something like that?
Especially in that area, there are a lot of retirees. If you go into that situation, you don't know what you're coming out with.
Yeah. So that's an example that not slamming surgery. Sometimes you need to have surgery. You don't need to have surgery, but there's always risk. And if there's something you can do to avoid surgery, you should do it. And the other thing you got to keep in mind is if you replace a joint, an artificial joint's never as good as what God gave you.
Right.
So if there's a potential to fix what God gave you, why not do it? And that's what regenerative medicine allows for some people. Not everyone qualifies, obviously.
But I want to ask you this. Do you think that the medical profession, because we talked about this off the air, but the medical profession, they're putting these people through the rigors of, this is what's been done in the past. Do you think it's because they can't? Everybody does continuing education, but I don't think they're looking at the regenerative part, right? They're looking at replacing a valve or a hip or something like that. They're not looking for what's going to stave that off or what's an alternative method, right?
No, I mean, we'll do a show on what's messed up with healthcare. So not really, but here's the reality. So surgeons make money doing surgery, right?
Right.
It's that simple. So a typical knee replacement at this point costs between $35,000 and $45,000 for one knee. So and really what's happened now is they don't make a bunch of money for the surgery, but you see all these beautiful outpatient surgery centers they're putting up all over Columbus. Right. Like there's a new one they put right at Easton, like right at the corner. That real estate had to cost God knows how much.
It looks great. I just don't want to go in it.
So what the racket is now is when you do these procedures, you do it in these outpatient surgery centers, and the facility fees are $30,000 to $40,000. Like they don't get paid a lot of money for the surgery, but the facility fees and the surgeons own the facilities. So every orthopedic surgeon in Columbus is a millionaire. And I'm not saying, and sometimes surgeons are needed though, so I'm not talking anything bad about orthopedic surgeons, but they're overdone. And people say, well, if it's so good, why doesn't my doctor tell me about it? Well, a regenerative medicine procedure can be as cheap as $200. So if you go to the surgeon and you can make $35,000 to $40,000 or $200, like it's a matter of economics.
Right. Well, it's also what they do, right? They're trained to do these procedures. So they're going to look at it and go, I can fix that as the doctor. So you might as well let me do it, right?
Yeah.
So it's easier for them because also it's not their body.
Well, number one, they're not trained on regenerative medicine. There's no regenerative medicine training in any medical school in the United States. So, and all continuing education is run by the drug company. So when you do your continuing education, it's going to be about some drug that's out there. So for a physician to learn how to do regenerative medicine, they're going to have to go outside and pay out of their pocket. The fellowships that Dr. Bain and myself went to was $30,000 a piece. Most physicians aren't going to spend $30,000, and a surgeon for sure isn't going to spend $30,000 to learn how to make less money.
Right, to do bioidenticals, and it doesn't make you any more money. It helps the patient, but it doesn't generate revenue.
It doesn't make business sense. And at the end of the day, it's a business.
Right.
And they're not bad people. And many people need surgery, and they do an amazing job. So we're not slamming surgeons today. But the way things are set up, it just doesn't make sense. But in Europe, it's been this way in Europe, everyone has terrible insurance. It's socialized health care. So the people with money in Europe spend cash to get stuff done. And that's why regenerative medicine took off in Europe prior to here. Because, 10 years ago in Europe, everyone had terrible insurance like we have here today. So people with money, if you're going to pay money, you might as well pay for something that works.
Right.
Now, the beauty now is everyone's insurance stinks here too. And this has also driven the cost of regenerative medicine down. Anybody can afford to get a stem cell allograft at this point. You don't have to be Kobe Bryant. anybody can afford it. We have people that come in. We're doing multiple procedures every day. From school teachers to retired mechanics. The price has come down for sure, and the procedures for those who qualify work amazing. Our success rate is over 86%. You might say, well, it's not 100%. Well,
nothing is 100%.
Surgery isn't 100%. I'll tell you, surgery is not even close to that. So, like, you're not going to find better if Dr. Bain accepts you, you're going to get a result. You're going to get a result.
And if she accepts you, there's a high likelihood that it's going to work because she doesn't just accept everybody.
No, and I tell people that the reality is when people come to our office, probably half the people get rejected.
Right.
You know what I'm saying? Now, if you're listening, that doesn't mean, I'm not going to try it. I've been told I'm really bad. I can't tell you how many people have come to our office that have said, there's no way you're going to help on bone. I have to have surgery. And we'll take an x-ray and they're not even that bad. So, I always say, come get checked out. We're not going to waste your time or money. Get checked out and see if you're qualified. It's that simple. It's about a 30-minute visit. And if you mention the radio show, we don't even charge you. You have nothing to lose.
Right.
And you can come there and we'll look at you. And if it's something you qualify, then you got to make a decision. Do I want to go to surgery and replace that joint, or do I want to try the allograft and try to let the body heal itself?
Do you get a lot of people that come in, because, again, we've been doing the show for a few years and we market this. Do you get people that are coming in because they want you as the second opinion? Or is it because they're probably not being referred, right? A physician's not going to refer.
We never get referrals.
Right.
Because once again, it doesn't make business sense.
Right.
Right.
You're taking money off the table if I say this guy can do HRT or PRP to you and you can stay off the surgery. You're probably the last in line they want you to see, but it's worth getting that.
The car salesman's not going to tell you, why don't you just clean up your car and give it to him, right? He wants to sell you a car. And he's not wrong for it. I mean, It is what it is. That's just the way the game is set up, right?
Right.
So, the same thing. The majority of our patients, I'll tell you, I would say 35 to 40% of our patients are people that have already had a joint replacement that was a failure. They're not happy with the results, and they're due to have another one done. So they're scared. That's probably 35 to 40%. I would say the rest of them are people, the other large proportion are people that have been told they have to have a joint replacement surgery, and they're afraid of the surgery. I mean, YouTube joint replacement surgery, the procedure is a pretty big deal. Like, they're literally, I would say, a good orthopedic surgeon would be a great mechanic or a good woodworker, because it's the same exact tools they use on that kind of stuff, just sterilized.
Right.
And it's a miracle. When necessary, it's a miracle. I'm not downgrading it, but it's a big deal. Cutting your knee out, you cut the bone off the top of the femur and the tibialis. I mean, it's a big deal. And putting an artificial one in there. And the other thing people have to think about: artificial joints last 10 to 20 years. If you're active, about 10. If you're a couch potato, about 20.
So you're going in again.
Yeah, so,
because
if I'm 50 and I plan on being around until I'm 90, then you have the calculator in it, and I'm pretty damn active. So I'm going to have to do it again when I'm 60, again when I'm 70, again when I'm 80.
And bouncing back from that surgery in your 60s, 70s, and 80s is a lot different than 45 to 50 years old. Correct.
So these are all things you have to consider, and I think a lot of people don't think about this and just, I'm going to go with my insurance. My doctor said I had to do it. I mean, always get a second opinion. You don't have to take the second opinion, but why wouldn't you? Just at least take the information, then make a decision, an educated decision.
What's the reaction you get when somebody does come in and my doctor's recommended surgery, and because I've seen you do this in hallways where our buddy Chris, who was limping around like a pirate for the longest time, and you told him, don't get those injections that are weakening your joint, right? Because eventually he was going to have knee replacement surgery.
Yeah, so Chris was doing cortisone injections,
yeah.
Which, if anyone's getting cortisone injections, number one, you're only allowed to get 3 cortisone injections per joint per year. And the reason for it, if a doctor would give you 4, it's medical malpractice. And the reason because that happens is the amount of damage that it does to the joint. So think about that. So you already have a joint that's messed up. That's why you're getting the cortisone injection. And then you're putting a substance in there that destroys the joint. Each injection causes up to 8% bone loss.
Because it's a foreign substance. It's not like a bioidentical, which is there to repair. It's a foreign substance. So your body is dealing with the pain, but it's masking the pain versus repairing the issue.
Yeah, so what you have to understand, in order to heal, step one is you have to have pain. Because pain and inflammation are the same thing. So if you have any joint in your body that hurts, that means you have inflammation in that joint. But that inflammation serves a purpose. First of all, the pain tells you what you should and shouldn't be doing, right? So if it hurts, don't do it.
Right.
And if it continues to hurt for a period of time, get it fixed. It's kind of like your check engine light. If your check engine light comes on, you don't floor you don't race the guy next to you. You probably say, oh man, I better take it easy and hopefully it goes out.
But you also don't ignore it for 6 months.
And if it doesn't get better, maybe you turn the car on off a couple times, it's still on. Oh, something's wrong. I better get this thing checked out. When you take a pain medication, whether it's an NSAID, muscle relaxer, opioid, cortisone, it's the equivalent of putting duct tape over the check engine light. You didn't fix anything. You just covered the light up, covered up the warning. So if you wouldn't do it to your car, why would you do it to your body? It doesn't even make sense, right? And on top of that, what you got to keep in mind is prostaglandins are what your joints need to heal in stem cells. These are two things. NSAIDs, which are Tylenol, Aleve, Advil, these all inhibit prostaglandin formation. So anybody who's taking NSAIDs, which are over the counter, we're not talking about prescription, over the counter, Advil, Aleve, whatever that, I don't even know, all these the name brands.
Everything you see on TV constantly for pain relief.
Yeah, if you're taking those on a daily basis, number one, you're going to end up with either kidney, liver, or gastrointestinal problems. Last year, the FDA estimated 20,000 people died in the U.S. from taking over-the-counter NSAIDs. That's the 16th leading cause of death in the U.S. Think about that. 16th leading cause of death. On top of that, you're inhibiting your body's prostaglandin formation. So not only is the arthritis going to get worse in that joint, you're going to get arthritis all through your body because you're inhibiting the body's ability to heal joints. So, and I'm not, if you have a headache, take an Advil. I don't care. You stub your toe, fine.
But if you have a headache for 6 months in a row.
You can't take it as, there's people, and what happens is this. Two things. Number one, well, it's over the counter, so it must be safe. Well, is alcohol safe to drink every day? You can buy that over the counter, right?
Yeah,
right?
That's true.
So, but and number two, if you read the directions, it says take for 10 days only. After that, go see your physician. The reason being is after 10 days, if it ain't better with it, it's not going to get better.
Right. And you're giving yourself another problem because you're dealing with your liver, your enzymes. But
people come in, well, I take, how's it affecting you? Well, my stomach burns all the time, so now I take Prilosec. Well,
or their throat. You have a lot of people that have these digestive tract issues. Well, what's been wrong? Well, my knee was hurting, so I was taking Advil or Tylenol over and over.
Well, Tylenol destroys your liver.
Right, but I'm saying they are taking these to mask what's going on somewhere else, but it has an effect on your system because it's not a naturally occurring substance in your body. So it is still, I don't want to say drug abuse, but whatever you're putting in your system, if it's not a bioidentical, your body's going to fight that a little bit over time. It's going to wear something out.
It affects you systemically, So if we use an injectable form of Advil in our office to put into joints because it makes sense. If someone has inflammation, it's okay to try it for short-term use. We come in and we can put it into the joint, but we'll only do it a couple times. If it doesn't help you right off the bat, it's not going to help you. But when you take it orally, it affects you systemically. It goes to your gastrointestinal tract, and you have to take a much higher dose because obviously it gets diluted when it goes out through your whole body. Where we inject it, it's about 1/10 of the dosage, right where you need the thing to be, right? So once again, there's a use for all these medications, but the abuse level in our country is ridiculous. If you go to Sam's Club or Costco, they sell like the big 2,000 bottles.
Oh, yeah.
Well, if you're only allowed to take, 6 a day for 10 days in a row, that's like a lifetime supply.
Right.
But people assume, well, because they can buy that much, it must be okay.
Right.
Well, you can buy a keg of beer. That doesn't mean it's okay to drink the whole keg.
Well, I think if you look at when we were, 10, 20 years ago, all the people we were with that were extremely active people, their body's starting to break down because we didn't know any better. We were taking Advil every single day because my elbow hurts, my knee hurts, or whatever. Those are the same people that are coming to the clinic now that need these bioidenticals, the PRP and the HRT, because you did kind of overtax your body, but now you're going to live another 20, 30 years if you're lucky. Maybe
people are living longer now than ever, which is good, right?
Right, but I think we were all trying to use up everything we could when we're in our 20s and 30s. Your body needs something, and it's not always surgery. There are things that can get you back up and running, like the HRT program. That brings people back to life. It's taking people that, when they do their blood work, and I know one guy, it said his body was really 71 years old. And after a year of that, he's only 44 years old. He feels tremendously better. But because he took the plan that was provided and he followed that plan to get his health back in line.
And everything we do at Buckeye, whether it's bioidentical hormones, stem cell allografts, all we're doing is simply replacing what your body no longer has. It's not something new. It's not some foreign substance. A stem cell allograft is literally they take basically where these come from is from umbilical cords. It's not aborted babies or anything like that.
It's donated.
Yeah. So So basically, what happens where the cords come from is females that have full term, healthy, live births, C-section only. You know, if you're having a C-section, the way it works is it'll say, "Hey, Mike, you're going to have your baby next Tuesday at 3." Okay, that works great. Would you like to donate the umbilical cord? Because otherwise, we're disposing of it. If the female consents to that, then those females are pre-screened in the screening process. You know, if they had the flu in the past 3 months, they don't qualify. If they had a tattoo in the past year, if you left the country, you know, multiple sex partners, you know, the obvious questions. If any of those happen, you're disqualified. But if you pass that initial screening process, when they have their C-section, then they harvest that cord. And it's regulated by the American Association of Tissue Banks. So the same people that harvest kidneys and livers and hearts and all that kind of stuff are the people that are harvesting these cords. So it's a very sterile process. And then the product, the cord is sent out for testing for all known bacteria and viruses. And if it passes that screening process, that's the tissue that we're using in our clinic. And that tissue is loaded not only with stem cells, but also long-chain hyaluronic acid, over 3,000 growth factors, exosomes, cytokines, everything your body needs to heal. And when you introduce this cushion into a joint, basically what it does is it strengthens the body's own signaling and attracts your own stem cells there to actually help stop degeneration and regrow tissue. It's that simple. You feel like a young person again.
When you say that, I always think it's that simple. All those things that you just said, I mean, it all works, but the common person, literally what they want to know is, will it regrow tissue? Yes, it will.
The body will regrow tissue.
Right.
The body will. You know, and if you question everyone, if you're alive, you have the ability to heal. And if you question that, if you got cut, would your cut heal?
Yeah.
The answer is yeah. So those same stem cells that should be healing your cut should be healing your joints, but your joints don't heal. So, and the reason for that is a couple reasons. Number one, as you get older, you have less stem cells. You know, so in less stem cells, less ability to heal. The second thing that happens is, if you think about it, the injuries that most people have, and what we really treat a lot of at Buckeye, in particular in older people, are joints, tendons, and ligaments. And the reason it's joints, tendons, and ligaments and not so much muscle is after you get through puberty, your circulation decreases to those tissues, joints, tendons, ligaments. And stem cells have to have oxygen to release their growth factors. That's how they fix you. And if there's no oxygen there, they won't do their job. And that's why, you know, so if someone has a bad knee, it's never the muscles around the knee, it's the knee joint. And if they have a bad back, it's not their back muscles, which work just as hard as everything else, it's the back joint, because of the poor circulation, their own stem cells can't get there and do their job. You know, and the other example you can give that is, you know, if you think of a Band-Aid, the purpose of a Band-Aid is to prevent liquid from leaking from your body, right? But a Band-Aid's got a bunch of holes in it. So why the hell does it have holes in it?
To the oxygen, right?
Yeah, because if you put duct tape on a cut, guess what doesn't happen?
It doesn't heal.
Because there's no oxygen, so the stem cells can't heal the cut. But the same thing happens in your joint. So what we do at Buckeye, you know, step one is you got to create a healthy environment. So we get oxygen to the joint. We inject medical grade ozone, and we also use shockwave and laser therapy to create a healthy environment, get the circulation going in those joints again, like you did when you were a young person. And then if you're the worst of the worst and there's no tissue left, that's when we add the umbilical cord tissue to the joint. And that cushioning there, along with the increased oxygen supply, gets the body to heal itself. So
and that's where you get a lot of people that are doing it to the knee or shoulder, correct? To rebuild that
bone
tissue.
on bone. Bone on bone.
And that's going to happen to a lot of people anyway as they get older. But that's where they get into the surgical part, where someone will say, "Well, you're bone on bone. We've got to change that."
We got to put a fake one. We got to put a take that out. Put a
versus the stem cell will reverse that issue and build on it, not do something invasive, move things around, and then hope it grows around it.
Correct.
Because that doesn't stimulate growth either. Just doing the surgery and moving around, it's not like a stem cell where that is going to build tissue for you.
No. When you do surgery, you're simply cutting it out and replacing it.
Right.
With a synthetic, which is going to last 10 to 20 years.
Right.
On top of the risk and everything.
But I thought that was the important differential to make, is that when you're growing the tissue within yourself with bioidenticals, it's different than moving things around that were not supposed to be moved or replacing.
Mm-hmm. And there's no matching issues whatsoever. People say, well, you know, what about rejection medications? Well, the umbilical cord tissue, there's no blood in it. So because there's no blood, there's no rejection issues whatsoever. It's a universal donor. So these things are what they call HLA antibody privileged. So when you put them in the body gladly accepts them, and it starts this whole healing process. So the way I like to analogize it, it's kind of like, picture you have a garden with a bunch of sand in it. Nothing's growing. That's what your old worn out joint is. So when we put these allografts in there, it's like putting the highest quality topsoil in there. Some with cow poop in it or something. You know what I'm saying? Like something really good, like
right.
really good, you know, with the best seeds. Obviously, stuff's going to grow, and that's what this does. And the age doesn't matter because it's donated tissue. You know, I can't tell you how many patients in their 80s and 90s have done fantastic because age doesn't matter. because you're using donated tissue.
Right.
So that's the miracle of it. It's cool stuff.
It's cool, but it's also cool that, over the years, it's as these newer things have been introduced into the clinic to start with HRT, then PRP, and then the stem cells. You can see people of different walks of life they're getting their individualized treatment, but you're seeing them they're flourishing because they didn't have that recovery time of the surgeries, but also they're glad to be there. Like, they know they made the right choice there, and a lot of times it might have been their second or third opinion, but they came there because they wanted to know the absolute truth. How can I regrow this tissue? How can I heal?
And we're so busy at this point, when someone comes in for their consultation, there'll be other patients in the office every single time that have been through the procedure and had success. So when you come in, if number one, if you're listening to the radio show, it doesn't cost you anything to get evaluated. You should mention the radio show; it's free, so you have nothing to lose. But when you're there, when they're working up to see if you qualify or not, if you want to talk to someone who's had it done, there'll be someone there. There's enough. We've done enough people.
That is absolutely true.
Dr. Bain has done more than anyone in the Eastern United States. There's always someone in the office that's had a procedure done that's had a good effect. So we can pull someone in there. You can talk to them and ask about their experience. But I mean, this is real. It's real life. We're not making this stuff up. We're growing like crazy. We have people at this point. We have people from all over the country that come to the office to get treated. And Dr. Bain is actually she's going to Florida to treat someone. We're going down tomorrow. So,
well, I think when you come back from this trip,
we'll talk about it.
You should talk about who you're treating. But I would tell people to tune into that show because that's going to be really interesting.
Yeah. So, but at this point here, with over 3,000 procedures done, we have the experience. We know what works. We know also, more importantly, what doesn't work and who doesn't qualify. So you have nothing to lose. So once again, if you're sitting there listening and you have joint pain, you're taking pain pills every day, whether it's NSAIDs, opioids, or whatever, or if you're getting cortisone injections, just fast track surgery, just sign up for surgery. I mean, that's what you're doing. Any of that stuff, get a hold of us at Buckeye. The website's buckeyepmr.com. Make an appointment, come in. We won't charge you to check you out. If we can help you, we'll let you know. And if not, we'll let you know too. But you really have nothing to lose. Mike, thanks for coming on the show.
Thanks, Buzz.
Until next time.